Good evening. Mi Jung is off tonight. Those new restrictions take effect tomorrow and come as health officials are increasingly concerned about the impact of the Omicron variant on hospital capacity. CTV's Binder Sajjan begins our coverage.
Omicron is tearing through BC so quickly, officials want to buy some time to make sure hospitals and staff aren't overwhelmed. 4 days after putting restrictions in place, more measures.
But it became also really clear that if we didn't do something more dramatic, more intense right now, that we couldn't recover from it.
Starting Thursday to January 18th, a maximum of 6 people can be at a table. Seated events like games, movies, and concerts are at half capacity with vaccination checking and masking. Gyms, fitness centers, and dance studios are shut down. No indoor gatherings like weddings or parties are allowed, and bars and nightclubs will also close.
Your neighborhood pubs are still open. We have just had some new orders issued on Friday. We were looking forward to having a good holiday season. And to feel like we're going back to groups of 6 and 2 meters distance is a real step backwards. And it comes with serious financial consequences for our industry.
And there'll be more information on the kind of supports available in the coming days and the weeks ahead.
Cases are taking off in Vancouver, Fraser, and Island Health. Dr. Bonnie Henry says the data shows those who are unvaccinated are at highest risk of getting Omicron. Those who have 2 doses can still get it, but are less likely to end up in hospital or dying. BC believes boosters will make a difference, so will expand capacity by adding more clinics and pharmacies. Everyone 18 plus is expected to become eligible this spring.
Continuation of our approach, which is to focus on those who are most at risk first and to move our way down age categories in order to meet that test.
On January 4th, all scheduled surgeries will be paused as hospitalizations due to the coronavirus are expected to rise. The order on personal gatherings remains up to 10 other people. Dr. Henry expects all of us will be exposed to Omicron at some point.
You need to keep your groups as small as possible, and it needs to be the same group of people. So not one family here tonight and another tomorrow and lunch with friends the next day.
She considered the toll on people's mental health, which is why social gatherings aren't banned, adding there's also a big impact on healthcare workers.
People are so tired. We've had challenges getting people to work in vaccination clinics because it's the same people that work in our case and contact management. It's the same people that work in our testing centers. People need a break.
Okay, Binder joins us live with more on this tonight. So, Binder, a lot of changes announced today, but no ban on traveling within health regions. So what's the rationale for that?
Yeah, so Scott, Dr. Henry was asked about that, and she said travel restrictions can help slow the spread of the virus, but this is already in all the health regions. And she said she wanted to balance the need for people to be with their family, to be with their support systems, especially after this year. And so she decided against those travel restrictions. But again, the advice is to keep it small. Scott?
All right, thanks, Binder.